Hi, I'm Dr. Tressler, and today we're going to talk about headaches and why chiropractic care can help a lot of people with headaches and the point behind it. Today we take so much Tylenol, pain-relieving drugs, for headaches and other problems that it kills over 17,000 people every year. In fact, Tylenol, they're putting new regulations on Tylenol and these pain-relieving drugs because they're being abused and they're killing people. It's the number one cause of acute liver failure, kidney damage. It can cause stomach problems. It's just serious medication that just keep taking to cover up a problem. Obviously, it doesn't correct the problem. It just covers up the pain. And I understand when you're in pain, you have to get through your day, but continually cover it up with drugs that are very harmful to your body and potentially life-threatening, not the way to go. So when we're looking at headaches and what can cause headaches, so many times pressure in the neck, stress in the neck, muscles, and nerve pressure can cause headaches. One thing is we're starting to see so much of forward head posture. Here's a great poster that illustrates that. When the head should be over the shoulders. So our ears should be over our shoulder. And this is something you can check on yourself, or maybe have somebody check for you. You can check with your family or people at work, is your ears should be over your shoulder. If the head starts falling forward like this, what that does to the spine is it stretches it out. Now what's attached back there are muscles. And muscles are holding your head on, and they're being strained all day long. They're exhausted by the end of the day. That's why your neck hurts and your shoulders and traps are sore, because they're holding your head on all day long. If you do computer work or desk work, that complicates things. Now what do kids do? Kids are sitting texting all day long with their head like this, working on computers, reading books. All their activities are doing this. We're developing a horrible epidemic on kids that are already starting to have forward head posture as early as 10, 12, 14 years old. So you need to check your children for this too, because this will cause breakdown and degeneration in the neck and cause much more serious problems later, as you'll see. But that's one thing. You check that in the nerves inside. What happens, those nerves that go up into the head, the circulation up into the head, the spinal cord that supplies the nutrients into the brain are being choked off when the head goes forward. And it compresses the nerves and spinal cord along with the muscles. And you can't take a bottle of Tylenol and fix this. You're not going to take a bottle of acetaminophen and fix that. You may cover up the pain, but you're not correcting the problem. And that's dangerous, because at one point there's going to be a breaking point, and you could have some serious complications there. Here's another poster, carpal tunnel and the double crest syndrome. So many people with the forward head posture, or if your neck is being crooked, you look at it in the mirror and your neck is crooked, or your shoulder is high or low, then what happens is the spine gets kinked, again just like forward head, and compresses not only muscles but the nerves inside there. Now one very common effect of this is carpal tunnel. The nerves from the neck exit the neck through the shoulder. How many people have shoulder pain or trap pain? Down through the arm, through the elbow, you can have pressure there, down to the arm all the way through the wrist. Now, the nerves from the wrist, the carpal bones surround this, so that's your carpal area, and the nerves go into your hand. So when you get tingling here, where do they check? They don't check here, they check there. And they say you have carpal tunnel. Where do they do surgery? Here. They never check that. It starts here. If a light is out in your house, you have to follow it back to the switch or follow it back to your fuse box. You just don't keep putting light bulbs in. You turn on the switch in your house. That's where this originates, up in your neck. Here's another study that we use in our office, a very scientific study. It's a thermograph study measuring heat. And if the nerves in the neck are irritated that exit both sides, we'll show an imbalance there. So it shows nerve pressure, and if there's pinched nerves. So what we do is we take this and we check the heat up your spine, and it measures it bilaterally on each side and puts it on the computer. So if we pull in here to the computer, we'll show you. Here's a test we just did the other day on a woman who had many health problems, and these red big black bars should not be there. The red is severe stress, blue is severe stress, green is mild, and the white is within normal limits. She only had one white. A lot of imbalances here compared to the right side. So obviously there's a big imbalance in her neck. And when we took her x-ray showed she had tremendous stress in her neck, tremendous arthritis and degeneration, which showed up on the test. So the test is just another way to look at what we need to x-ray, and if there is nerve pressure, it will show up on the test. Another thing we do is after we do check your posture, if your posture is out of balance, or do the thermal scan to see if the heat, there's any imbalances there, as we take x-rays. And the x-rays show us exactly how your spine is lined up. If you have curvatures, an x-ray will show that. You can't look at that from the outside and see that. So if your doctor is saying your spine is fine, without an x-ray, there's no way, it's impossible to see that. From the side view of your neck, we don't know if your spine is curved or not until we take an x-ray. If it's not curved and it's been wearing out for years after year after year, we'll show degeneration and arthritis. That is not normal. Common, but not normal. Don't be duped into thinking, oh, my doctor tells me I have arthritis, that's why I have headaches. There's a reason you have arthritis. Your neck is probably out of alignment. So let's look here. From a side view of the neck, we should have a big banana-shaped curve in the neck. That's anatomically normal. Medical research says that's normal, a 45-degree bend in the neck. That allows for the spring action for your body to absorb the stress from your head. The head is over the shoulders. Here's a person that came in. Look at the difference. So many headaches are caused by this. There was research that shows over 70% of headaches are due to misalignments in the neck. 70%. So you can see there's no curve in the neck. The neck is completely, instead of having a nice arc in it, completely stressed forward, straining, and that will strain all the way to the low back. In fact, this gentleman who came in had low back problems. He had earaches and sinus pressure and some headaches, but he had more low back problems than anything. It's straining the whole way down there. So when we take an x-ray, our job here is to start correcting it. I don't want to just mask the pain with an adjustment or massage. I want to start correcting the position of the neck so the body can heal itself. So here's his x-ray after he's been under care. So he got under initial care to start correcting the problem. I showed him how to maintain it, and we just kept him on a maintenance program to help him. He did some things at home, simple things, and over a year's time, look what happened to his neck. It reconstructed itself. These things don't correct overnight, but if you have the proper game plan, they will correct, and they'll get the curve back in the neck, and you'll have your health back. Now, when we look over here at this poster, the reason this is so important is the curve in the neck, that's compressed. It compresses nerves going to your heart, your lungs, your thyroid, up into your head for headaches or vision problems. We see a lot of children with vision problems. We start adjusting their neck, their vision changes. Sinuses, tonsillitis, ear infections can all be caused from this. Here's an x-ray of two children. One, this is my child, Mackenzie, when she was 5. We took an x-ray. She had a normal bend in her neck. You can see all these bones are smaller. Normal bend, healthy nerve supply from her brain to her body. She's going to have incredible health, which she has. She's now 12. She's had incredible health ever since she was born. In fact, I have 5 children, and they all have just wonderful health. And I thank God for that. I thank God for the information I know about this and how to take care of the spine properly to maintain a healthy body. Here's a boy that we x-rayed that was in a whiplash accident. He was riding his bike and he got injured, and look at the curve difference in his neck. There's no curve in his neck. The spinal cord itself is being stretched. It's attached to the brain, so it's being stretched. There's severe compression there. That's damaging to the body and health. This top bone here should be angled at an upward angle. That's straight across, which means there's brainstem pressure right at the base of the skull. That's not good. That's going to lead to severe health problems. When we see patients who have had this for a period of time and the spine starts to degenerate, we see asthma, we see headaches, we see arm pain, chronic lung problems or heart palpitations, thyroid problems. So if you have those type of situations, whether it's headaches or something else, you have to investigate your spine. You have to investigate the system that runs your body to see if it's being damaged. If you've been to a doctor and he hasn't taken x-rays or done this type of an exam, you need to have it done. You can't just depend on medication. You've got to get away from that. If you want to spend your life on medication, then that's your choice. But most people don't want to be on medication. You have to find the cause of the problem. That's what we do here. We find the cause. If I can help you in any way, if you live in my area or if you live out of state, we'll help you. You just email me, contact me, I'll help you find somebody that can help you and get your life back and maintain incredible, awesome health. Thanks.